In the inpatient care unit, it's important to wash your hands before and after every patient contact, before and after eating, after using the restroom. Use warm water and soap. Use good friction and rub your hands together for about 15 to 20 seconds. Soap up to your wrists, between your fingers, under your fingernails, around any jewelry that you have on, and rinse thoroughly with warm water. Dry your hands thoroughly with a paper towel, leaving the water running, and then you use another paper towel to clean the water off, rather than your bare hands. No matter if you are working in patient care, have administrative duties, follow the rules for good posture and use proper body mechanics. It's easier to follow these rules when you are dressed appropriately. Wear comfortable, professional clothes and shoes with a low, wide heel. With patient care, you may be asked to directly assist the patient with eating, bathing, positioning, transferring, walking, and possible other activities that may put some stress on you. With administrative duties, sitting for prolonged periods, reaching and lifting can also be stressful. Always protect yourself and don't do any activity you are uncomfortable with. Remember to raise the bed up to a height that's comfortable for you to work. Don't reach across to the other side, walk around the bed instead. This is true for making a bed or for working with a patient. After the fitted sheet, you put on the flat sheet, and then the pad, and finally the top sheet. Patients can get very uncomfortable if you leave a wrinkle in the sheet, so make sure you smooth out the wrinkle. When working with a patient on the acute care unit, remember to always treat the patient with respect. As you enter their environment, be careful not to startle them. Introduce yourself, tell them why you are there, and ask permission to proceed. Look to the staff member with whom you are working for guidance about whether gloves or other personal protective equipment are needed.
What size should you wear?
Medium.
Remember to raise the bed up to a comfortable working height. Explain the procedure to the patient.
When working with a patient at the bedside, raise the bed up to a height that is comfortable for you to work. Pulling a patient up in bed. Tip the head of the bed down and raise the lower part of the bed as needed. Stand close to the patient's side at about mid-torso. Grip the draw sheet with both hands a bit wider than shoulder width apart. Bend your knees, and on a count of 3, raise the patient up a few inches. Repeat as needed until the patient is at the level you need them to be. Pulling a patient closer to a side of the bed. Position yourself as before to pull towards you. Bend your knees. Make sure you are not using your arms only to pull. Rolling a patient. Bend the opposite leg of the patient to the direction you're rolling toward. Place the opposite arm across the patient's abdomen or have them reach across to the rail if they are able to. The patient may need just a bit of help by gently guiding the torso. Sitting a patient up from a lying down position. Slide the patient closer to the side they will be sitting up on as described before. Lower the bed. Bend the patient's hips and knees. Then gently drop the lower legs over the edge and raise the trunk up. Unless the patient can do most of this activity themselves, always have staff assistance. Standing from a sitting position. Have the patient slide close to the front of the bed, both knees bent with the stronger leg a bit more underneath them. Stand in front of the patient with your knees bent and your arms around their waist. On a count of 3, rock the patient to the upright position. They can assist by pushing up from the surface they are coming from. Transferring from the bed to a commode. Use the previous standing technique and guide the patient with small steps in the direction of the surface they are going to. Have them reach for the surface once they are directly in front of it and slowly lower them down. Give assistance as needed. The patient should have skid-resistant socks on or some other footwear. Never have them stand on a towel. This activity, as with all the above procedures, should be performed by a staff member. We can't stress enough the importance of using good posture and body mechanics to protect yourself, not only here at Capital Caring, but also with your daily activities. Remember, follow these techniques to help decrease the chance of injury to yourself and the patient. Only perform activities you are comfortable with, and have the assistance of a staff member as needed or be under the supervision of one.